This is Kristina, Khelsie, Mel, and Zena's Your Healthy Spine project for Dance 4. Our spines are important because without them, we quite literally would not be able to function properly. Our spine allows us to move and bend freely with flexibility. It also acts as protection for our spinal cord, which allows us to connect our brain to the rest of our body. Some ways to keep our spine healthy are by maintaining a healthy weight, lifting properly, staying hydrated, continuing to stretch your hips, monitoring your posture, and staying active. Seen in the image to the right is lordosis. Lordosis is a curving inward of the lower back. Some lordosis can be considered normal, however too much is referred to as sway back. Lordosis is known as a common vertebral disorder, which can be caused by poor posture or weak abdominal muscles. It can also be inherited. It is described as an unusually large inward arch on the lower back, just above the buttocks. In children, lordosis often fixes itself. However, if treatment is needed, this can include a back brace, physical exercise, and chiropractic treatment techniques. Kyphosis, which can also be referred to as hunchback, is a forward rounding of the back. Can be caused by excessive outward curvature of the spine, causing hunching of the back. This is more common in elder women and is considered a very common type of vertebral disorder. Some may experience back pain and stiffness, while others have no symptoms other than the forward rounding of the back. Severe kyphosis can cause back pain and can be disfiguring. Treatments can include the back brace, medications, spinal surgery, physical exercise, and physical therapy. Scoliosis, which is seen on the right, is a sideways curvature of the spine. It often occurs most during the growth spurt period right before puberty. Most cases of scoliosis are mild, however some children can develop deformities that get more severe as they grow. Oftentimes no treatment is needed, however in some cases a brace or surgery is needed. This type of vertebral disorder is very common. Treatment depends on severity, however it can be treated with surgery, a back brace, physical exercise, and stretching.
Our spines are so important because they allow us to bend in all directions while still providing support and protection of our spinal cords. In turn, the protection of the spinal cord is very important because it contains all the nerves that connect the rest of the body to the brain and allow a person to control their movements of their whole body. An article by Performance Optimal Health reviews 4 common back issues a dancer may have to deal with. First of all, spondylolysis, more commonly known as stress fractures, occur in the pars inarticularis, which is the thin bone segment that joins 2 vertebrae. Like the name suggests, stress fractures are caused by repeated stress on certain bones. This spinal injury is quite common in dancers, namely ballet and modern dancers. This is because of the repeated extension and flexion of the back that is common within movements of these dance styles. Repetitive jumping, especially without proper form, can also contribute to this injury. Secondly, discogenic back pain is also a common issue for dancers. This accounts for about 40% of back pain cases. Much like stress fractures, discogenic back pain is caused and aggravated by the bending and twisting of the back. It is often described to be a dull pain that can radiate down the legs, which also may cause muscle weakness. Third, we have lumbar strains or muscle spasms, which are also common injuries in dance that are often caused by the overuse of muscles and muscle imbalance. Lumbar strains are often described to cause sharp pains adjacent to the spine. Lastly, sacroiliac joint sprains, or SIJ sprains, are common in dancers as they are caused by repeated lumbar hyperextension. The article mentions that ballet dancers said that jumping, hyperextension of the back, and abduction of the hips, such as in développé à la seconde, can all cause pain.
Why is our spine so important, and what must we do to keep it healthy? Our spine is important because it plays a crucial role in supporting the body and enables movement. To keep our spine healthy, we must incorporate a daily routine of exercise, maintain a good posture, balanced diet, and prioritize the way our body feels, such as rest and recovery. Treatment and prevention. To prevent ruining our spine in the future, we must exercise regularly, have proper posture, manage our weight, regular stretching, avoiding prolonged sedentary positions. What would back rehabilitation look like? This would consist of physical therapy, stretching, pain management, lifestyle adjustments, and most important, working on consistency. Without being committed to your goal, change and growth will not be shown due to lack of effort. How can dancers prevent having back issues? What are some important tips? Dancers are able to prevent back issues by focusing on proper technique, maintaining good posture, as well as strengthen their core muscles to support the spine. Important tips to prevent such an issue is to incorporate warm-ups and stretching routines before dancing to prepare the body for movement while reducing the chances of strain.
Why is our spine so important and what must we do to keep it healthy? Our spine is important because it gives our body structure and support. Our spine gives us the ability to be flexible and bend freely. It also protects our spinal cord. A way to keep our spine healthy is strengthening our core muscles, stretching daily, stand and sit up straight, take walks, reduce pressure on your back when you sleep, lift weights correctly, which is with your back straight and knees. And the remaining slides shows the weekly diet for good nutrition and healthy back that I have planned.
We will now explain and demonstrate a few exercises and stretches. For the first exercise, bird dog, start with your hands and knees on the floor. Draw your shoulder blades together, then raise your right arm and left leg, keeping your shoulders and hips parallel to the floor. Lengthen the back of your neck and tuck your chin into your chest to gaze down at the floor. Hold this position for a few seconds, then lower back to the starting position. 2 to 3 sets of 6 to 10 repetitions on each side are recommended.
The next exercise we have is push-ups. Starting in a plank position, lower yourself by keeping your elbows in and bending them to 90 degrees. Remember to keep your back straight and your core tight. Return to the starting position. If unable to do push-ups starting in plank position, you can modify this exercise by starting with a plank on your knees. 2 sets of 10 each day is recommended.
The next stretch is the modified seat side straddle. Sit on the floor with one leg extended to the side and the other leg bent as shown. Place both hands on the ankle of the extended leg and bring your chin as close to your knee as possible. Hold the maximum stretch for 30 seconds and then relax for 30 seconds. Reverse leg positions and repeat on the other side. Repeat this sequence 10 times. The next stretch is called the lower back rotational stretch. Lie on your back with your knees bent and your feet flat on the floor. Keep your shoulders firmly on the floor and slowly roll your bent knees to one side. Hold for 5 to 10 seconds. Slowly go back to the starting position, then repeat on the other side. Repeat each stretch 2 to 3 times. Do the full routine once in the morning and once in the evening if possible. Lie on your side with your forearm under your shoulder and your feet stacked one on top of the other. Push your forearm away from your body and lift your hips up into the air, supporting your weight on your forearm and feet. Hold this position for this prescribed amount of time, switch sides, and repeat. Be sure to keep your body in a straight line and your abdominal muscles drawn in. You should feel this working on your shoulders and your torso. 2 to 3 sets is a good place to start. However, adding 1 set to your workouts will help with your core strength. This is called the side plank. Our next exercise is the curl up. Place your hands at your sides and place your knees up. Slowly rise your head up, then back down. Do 2 sets of 15 repetitions, then progressively increase. The next exercise is the bridge. Start laying on your back, knees bent, and feet flat on the ground, about hip width apart. Bring your hands up by your head, fingertips at about ear height. Suck your belly button into your spine to engage your abs. Press into your hands and press palms into the floor and feet into the ground as you push your hips towards the ceiling. Hold for 5 to 15 seconds, then tuck your chin towards your chest and slowly lower to the ground.
Another stretch that is good for your back is the lower back rotational stretch. Seated, cross one leg over the other, turning your upper body that way and pushing against your leg with the opposite arm. Hold this position for 10 seconds. Then do the other side. This will count as one set. 3 sets twice a day are recommended.
Thank you for listening.
Okay, continue.